name is Marissa and I researched in vitro fertilization. So, in vitro fertilization is also known as IVF and can have many benefits, such as creating a pregnancy that would not have been conceived otherwise. But research shows that there may be some risk involved to conceiving this way. Researchers presenting at the American Academy of Pediatrics AAP National Conference and Exhibition report that IVF may significantly increase congenital disability, especially in the heart, eyes, reproductive organs, and urinary systems. This causes many developmental disabilities. These risks can significantly affect a family as it is emotionally draining to care for a child with a congenital disability. And the studies researchers performed to learn about IVF producing various disabilities, they did their best to control the age, race, and specific recessive genes of the participants. Many studies were done over several conception processes, but IVF happened to show the most concerning results. While it is possible that other contributing factors in the woman's infertility may contribute to the child's possible disabilities, it still proves that the babies born after IVF were 1.25 times more likely to be born with abnormalities. While many of these abnormalities are small, some may be life-threatening or even detrimental to the child's quality of life over time. The most famous study by the researchers at the AAP compared groups of infants born from natural conception and groups of infants born from IVF. Anyone who considers IVF must speak to their doctor about the possible defects since the cause is still not proven and there are only theories of what reproductive gene could be causing these abnormalities. Since IVF had birth defects compared to 6.6% of babies who are conceived naturally, it is still a risk for the parents when there are other methods of conceptions. But in some cases, when the female is infertile, it may be the only option presented. I think that in many cases, IVF is the only safe way for infertile parents to conceive, and while there is still adoption, the process of conception is something some parents want to experience. I believe in order to go through with an IVF process, given the uncertain risks, the parents must be fully educated and discuss their personal history and requests with a healthcare provider before making their decision.